Good evening. My name is Jamie Chung, and I'm a student at the University of Texas at Arlington, College of Nursing and Health Innovation. This is Management of Nursing Operations. The conversation today is on Anchor Health growing in Los Angeles County. So on today's agenda, we will introduce Anchor Health, discuss our patient care delivery, our strategic plan, our marketing plan, projections, and a summary. So Anchor Health is a home-based hospice that services patients throughout California, with the newest location in Los Angeles County that needs a focus on growth. Anchor's health mission is as follows: to enrich the lives of patients and the communities we serve by providing compassionate end-of-life care through innovation, exceptional quality, and professionalism. Our experienced care team honors individual choice and is the anchor to support each patient's unique healthcare needs. Our patient care delivery. As with any hospice, we have 24/7 availability for patients or families to call for support. This can include a nurse that can do in-home visits or a physician available for orders. It also includes an interdisciplinary team, which includes the nurse, social worker, spiritual care counselor, home health aide, volunteer, and physician. Additionally, Anchor Health specifically has services of pet and music therapists. There are 4 levels of care which a patient can receive. This includes routine, continuous, general inpatient, and respite. Additionally, hospice covers the cost of all needs related to the patient's prognosis. This includes medications, supplies, and medical equipment, such as a bed or oxygen. So our strategic plan. In order to understand this, we need to understand Los Angeles. It is a very competitive market for hospices. To put things in perspective, Morrow pointed out in his 2022 article that California has 1 hospice per 1,600 people over 65, compared to Florida, which has 1 hospice per 95,000 people over 65. So with these numbers, you may think, why bother opening a hospice in Los Angeles? However, there are still numbers that show there are plenty of need for hospice in Los Angeles. For example, Find in 2018 reported that only 12 to 15% of days were spent on hospice in the last year of life of those Medicare recipients who actually received hospice care. With an expected prognosis of 6 months, we would expect this number to be closer to 50% of the last year of life spent on hospice. Additionally, Find reported that only 20% receive at least 1 day of hospice service. So that means 80% of Medicare recipients are not receiving hospice at all. California specifically, as ranked by the National Hospice and Palliative Care Organization, reports that we are ranked number 42 when comparing the percentage of Medicare recipients who die without hospice. So what are Anchor Health strengths? 1 is we have a very involved owner. We have Christy Keith, who helps keep the organization running. According to Johnson Jorgensen in 2020, reported that this involvement is critical for business success. Another strength is the strong ethical and moral baseline. Due to the number of hospices in the area, Medicare is constantly monitoring for fraud in the area. By ensuring that we are following all guidelines set forth by Medicare, we know that we will be able to provide this successful business model. Additionally, and most importantly, we have a desire to provide compassionate care, as stated in the mission. Regardless of any business interest, when providing compassionate care is the number 1 goal, the best patient quality will lead to business growth. Some weaknesses. As stated before, our geographic area poses some difficulties. Any mistake that Anchor Health may make, real or perceived, can lead to loss of confidence and a stop of referrals. Another weakness is currently Anchor Health does not have a strong business development team in Los Angeles. This is the team who is responsible for marketing and bringing in business, and we need to make some adjustments. Opportunities. As stated earlier in Find 2018, only 12 to 18% of hospice days are spent on hospice. If Anchor could identify and admit patients earlier in their life, not only would patients have better quality of care, the business would have more patient days. Additionally, with only 20% of patients receiving services, there's more room to give people the services they deserve. Threats. Once again, this geographic area. We have more competition, more hospices that are offering the same services. We have to find ways to set ourselves apart. And then growing pains. As with any other agency trying to get started, we have several things that we're just trying to figure out. For example, the risk of not being able to meet demand is a threat. Since the pandemic, nursing staff shortages are significant, and if Anchor Health cannot provide an increase in staff at the same rate as an increase in patient census, they will not be able to provide proper patient care. So, our marketing plan. So we must first understand our referral sources. Yes, referral sources often come from doctors, but they can also come from an individual patient, family member. They may come from the facility, skilled nursing, or assisted living where the patient is at. Case managers, either from the insurance, hospital, home health, or even religious communities. And the significance of these is that these are the people who we are marketing to. So today's focus is on the business development team. This is the people whose primary responsibility is to maintain and maintain community relationships. Initially, the company should have 2 community care coordinators, also known as CCCs, with the growth of 1 new CCC for every 30 patients. The initial CCCs should be experienced, and the number of patients that they bring in will be individualized based on marketing targets and experience. So the cost of this team, according to ZipRecruiter, the average salary for a CCC is around $64,000. These costs are included when we're calculating the cost per patient day. Additionally, marketing supplies cost about $100 per coordinator per month. These costs are kept intentionally low due to anti-kickback regulations. So projections. When calculating how much we can anticipate to make, we need to understand where the payments come from. So we have Medicare as our primary billing source, but we could also receive payments from Medi-Cal, private insurance, and technically private pay is an option, though a hospice is more likely to accept a pro bono patient than a private pay patient. So goals. Anchor Health has a goal of increasing hospice care from an average daily census of 10 to 30 by the end of year 1, 60 by the end of year 2, and 150 by the end of year 3. Now, how much does this cost? So, for the purposes of revenue projections, we calculate based on Medicare rates. We will also presume that annually 90% of patients are in routine level of care, 5% on respite, 3% on continuous care, and 2% on GIP. We will also presume that Medicare rates increase by 1.5% each year. With the rates published by the California Department of Health and Human Services, we could determine that rates per patient day in Los Angeles County would be approximately $232.92. Based on the goal of the ADC, we could project that by the end of year 1, we will have an income of just under $3 million. By the end of year 2, just under $6 million. And by the end of year 3, we will have an income of over $15 million. Now costs. How much does it cost to run an agency? According to Zhang, we are anticipating that costs are around $232.92 per patient day. If we also anticipate this increases 1.5% each year, year 1 costs will be about $2.5 million. For year 2 will be $5 million, and year 3, $13 million. So overall, this means that our revenue for year 1 is $375,000, year 2, $763,000, and year 3, just under $2 million. So in summary, despite Anchor Health's difficult market, there's plenty of room for growth. With the right business development team and the commitment to building the area, there's a lot of strong potential for Anchor Health. Here are my references.